So let's finish refracting. Another wonderful patient here today. And again, you don't have to, but if you can read, let me know. Can you see anything there?
Yes. H.
Wow.
SVN. ZCD. KSROH.
And doctors, I'm going very slowly, and you can see I do the refraction before surgery myself. I check them post-op because this is very important. These are not ordinary cases. This is a patient with extreme Lasik ectasia. He had LASIK surgery, which led to ectasia, became a surgical keratoconus, and he landed with vision of counting fingers, couldn't see the biggie. That's why I'm going slow, and I'm amazed how you can read that. Read that, please.
KSROH. ODZKV.
You don't have to, I'm just pushing you. Go.
RSOSZ.
Really? Again, give me that.
RHOSZ.
Lovely. Okay, pushing you. Don't have to, just try.
OZDVK.
Pushing you, come on.
RYKDZ.
Okay, I'll stop there. That's 2050. Pushing you. Don't have to, again, only if you can.
Let's go, let's try it. SKYDZ.
Okay. So, doctors, he's reading 2050. Came to us with count finger vision with Lasik complication done in the Carolinas, right?
Yes.
Yes, I remember.
South Carolina.
Right, and then you were referred here by your surgeon in California.
Yes, correct.
And then we performed for him corneoplasty-based intact ring segments in my titratable concept of different rings, different depth, and you could see he's reached and become what I call visual from a structural category. He can actually see now, and he's going down to 2050 confidently. I've refracted him right now. And first, anything you want to say to doctors who are always watching here? You were here on your post-op day one. You also saw people from all over the planet. Anything you want to say and teach, because he has a very dynamic profession on motorbikes, right?
Yes, I work for Giant Motorcycles to where I need my vision to see, and it's just awesome to have Dr. Gulani that fights for a vision. Everybody should fight for a vision. If we, as the patients, want to fight for a vision, why should you doctors not want to fight for us?
I'm sure doctors do fight. It was important also the concepts that we are sharing. How do you feel today, first of all? Any pain, anything during surgery today, anything?
No pain at all. All I feel is just happiness and greatness. My vision is getting better.
Pleasure. And doctors, he has come back a month later now. You already saw his video of day one where he was sitting with patients from all over the world, right? Remember? All of you sat across table like y'all share your stories before you fly back. And here he is, doc. You can even see the imaging adjusted. You can see both the rings. They're different depths you can see. Therefore, you see one is always in focus, one is not, but that's what tilts the cornea. You can see his LASIK flap is now moving in the area, and you can see the topographical changes. You can see this very big ectatic area of the cornea bulging from the Lasik complication. It has already started moving and becoming more regular and measurable. He has already improved 70%, which is a perception he also gives in his vision improvement. So you can see the direct improvement on this differential titratable intact technique to correct these blinding Lasik ectasia, which were only relegated to, what options were you given before this?
I was given no options.
Or transplants that most doctors are suggesting, but there is no need for that. You can actually save them and help them with this surgery that takes minutes. It's topical, brief, with drops. Any pain during surgery, any anxiety?
No pain at all, no.
Anything else you want to say for doctors? So I hope you understand the concepts. First of all, no case is impossible or difficult. They all deserve your fight, and keep it least interventional. It's very easy to do barbaric surgery, but that's not why patients come to you. Patients come to see, right? So keep your surgery difficult for yourself, easy on the patient, and yet you have documentation of how well they do. And more important, always patient on camera with no incentive, only highest accountability of any outcomes that you talk about. Anything that you want to talk about, Dave, in your history?
Yeah, I mean, just as far as real quick is You know, I had 2010 vision at one time, and then unfortunately, you know, I did LASIK 27 years ago when I first started coming out, and then fortunately my vision went bad, and I'm just very thankful I found Dr. Gulani to fight for my vision, because I want to fight for my vision, and so is he. And I'm very happy with everybody here at the Institute, and I'm just so thankful to be here today.
My pleasure. I will get back to your surgeon in California. I'll let him know, update him. And you continue doing your wheelies on your drives.
Hey, that's right.
Yeah, pleasure.
Thank you so much. Hey everyone, my name is Jay Totino. I wanted to share my story with you as far as my vision. It goes back 27 years ago when I had LASIK done in South Carolina. At that time, I actually had 20/10 vision. And then as I got a little bit older, unfortunately, dropped down to 20/20 vision, which most people have. And then I was out in California, and I my right eye was very blurry, so I went to a doctor out in California. When I was out in California, I got diagnosed by Keratoconus, and then I was, then the doctor out there told me about Dr. Gulani here in Jacksonville. So this is where I am now, talking to you. And the best part about it is that now, actually having a structural surgery in my right eye, I can actually see 20/50. And before, just to let you guys know, I couldn't even see the big E as far as an eye chart. So just an amazing difference. I am willing to fight for my vision, and I wish that more doctors like Dr. Gulani would fight for a vision, because if we're willing to fight for it, why would you guys not fight for it? So I'm so thankful and pleased I found Dr. Gulani, because he has fought for my vision, and I'm here to tell my story, to let everybody know to fight for your vision, don't give up, and find Dr. Gulani, and he will fight for your vision and make it to be able to where you can go from clear as mud vision that I had to soon to be crystal clear. Thank you so much for your time.